Well, thank you for giving the opportunity to present this study, and thank you for Dr. Napoli, because I think his presentation fits perfectly with this. So this is the further project. That is the project that will start on January 1st on next year. So, and on behalf, I present this on behalf of my colleague Lenny Verkooyen and this large group of people. Actually, this is not an exhaustive list. On the comparison between focused ultrasound and radiotherapy for non-invasive palliation pain treatment in patients with bone metastasis. So let me see how this, okay, this is the one. So of course you're all familiar with the fact that bone metastasis happen as a result of many different primary tumors, and worldwide it's pretty much over everywhere, pretty much the same picture. Of course, if drug treatment and opioids fail and there is no relief for the patients, then the standard treatment is radiotherapy. Radiotherapy is a fairly simple treatment. It's also fairly cost effective. However, as you have also heard before, it's only effective in, let's say, 60–70% of the cases, and it takes a while. So it takes 4 to 6 weeks to really kick in. Now, several studies on the background, several studies have indicated the efficacy of MR-HIFU, and several papers have been studied, and I think that one of the primary, background studies is really the study from Mark Horowitz and colleagues, and I think many of you here in the audience were have been involved in this study that demonstrated in a multi-center randomized trial that MR-HIFU is a safe and effective non-invasive treatment for alleviating pain caused by bone metastasis. The response of MR-HIFU was typically rapid, with about 2/3 of responses seen within days after treatment. However, the study was performed in patients who were ineligible, who failed or declined radiation. So its secondary, MR-HIFU was only secondary option. And that's one of the reasons that also where reimbursement is still fairly poor for MR-HIFU. Now, of course, I don't have to explain you again the options of MR-HIFU and how we do it. Again, on this graph on the left side, you can see the green part. You can see the time on the horizontal X, the time after therapy, and sort of the green part where we managed to get pain relief with current radiation therapy and so on. But the red part is still where the period of and the patients who still suffer from large patient population who still suffers from pain that is not manageable by opioids. So the design of the further study, and that's a multi-site clinical study, is actually there are a number of work packages. The center of that is really the, let's put it this, work package 3, I think it is this multi-site clinical trial that has primary in first-line radiation therapy versus first-line MR-HIFU, or a combination of those. And then there is also cost effectiveness that will also be part of this study, and there will be a single site, and that's in the United Kingdom, on actually have this as part of a more broader pain palliation treatment. Now all of this feeds then into let's say getting these results, and also having patient groups and insurance companies involved in this, and all of this together is. There will be preceded by a small clinical trial on the bottom, but I won't go into very much detail how this works. It combines actually 6 hospitals in Europe. Apart from the University Medical Center in Utrecht, in Cologne, the Uniclinic, we have Turku in Finland, the Royal Marsden in Oxford, and the Sapienza with Alexander Napoli. It is Bologna, and as well with the Focused Ultrasound Foundation, who will play an important role in this. So with this, just to give the quick summary, it's a 5-year, 4 million euros projects funded by the European, with the main aim of MR-HIFU as a standard, now first-line treatment alternative to external beam radiation therapy, effectiveness, but also cost-effectiveness of MR-HIFU compared to that EBRT as palliative treatment option to relieve bone pain caused by metastasis. And it's supposed to start in January 2019. And that's all. Thank you for your attention.
We hope that we can convince the scientific community with this project.
We really look forward to it. Yeah.
Any question? Okay, I think we can move on.
Okay, just maybe
I'm
one.
sorry.
I'm just curious about your endpoints. Are you looking at a non-inferior efficacy endpoint?
The main, one of the main endpoints is, of course, pain. There are some secondary ones, but the main one is pain, and that's after 2 weeks. Because 2 weeks, of course, that would be perfect for this. We are sure that, we are pretty sure that MR-HIFU should have kicked in this, and then EBRT is still not valid. So that gives us the best chance to show that really MR-HIFU is a valid alternative for that short period.
And then referring back to the previous talk by Dr. Napoli, where essentially demonstrated non-inferior efficacy.
Yes.
And I didn't necessarily, maybe I missed it on the slide, but verbally you kind of mentioned that the adverse event profile was more favorable for the MR-guided HIFU. So I was just wondering if you're going to do non-inferior efficacy or superior efficacy. Are you also thinking about like a superior safety type of endpoint?
No, the main thing is really just pain, and of course we have to make sure that it's really a randomized clinical trial, so the assignment is really random, and that is one of the most important things. And then it's pain and measured at 2 weeks. That's the main thing. There are some secondary things like tumor control and so on in some cases, and I refer to the previous speakers. I think that, but in this one, the main thing, the primary is really pain at 2 weeks.
Thank you.
Okay.
Thank you.
Thanks.